Ever wondered how a doctor deciphers those medical scans? Well, we're about to crack the code.
You might think it's just looking for something obvious, but it's so much more than that.
Yeah, it's kind of like detective work. Radiologists are hunting for tiny clues hidden in those images.
And they have a secret weapon, diagnostic pearls. Think of them as expert-level shortcuts to the truth. All right, let's see how this works. Sometimes, clues from all over the body point to just one culprit.
So, our detective might find 4 separate clues. A curved spine, a skull issue. They seem unrelated, right?
On their own, each one is a puzzle piece, but put them together, it builds a case for NF1.
And get this, location is everything. Tumors on one nerve mean NF1. On another, it's NF2.
Okay, let's level up. Profiling brain tumors is some seriously high-stakes detective work.
You see, a tumor's behavior is a huge clue. If it crosses the brain's center line, that screams glioblastoma. But sometimes, the biggest clue isn't in the scan itself, it's the patient's age. Check this out.
Okay, so you see this cyst with a nodule in a kid's brain. But what if it's in an adult?
Yep, it's a totally different tumor. That one detail changes everything. That's pure expertise right there.
And this isn't just for brain tumors. No, these diagnostic pearls, they're found all over the body.
Take trauma, for instance. The pattern of facial fractures tells you exactly how severe the injury was.
What about hearing loss in an adult? That's a classic clue pointing right to otosclerosis.
Even dementia leaves fingerprints. This specific pattern, it's a dead ringer for Lewy body dementia.
So you see, from trauma to hearing loss, these pearls cover literally everything at every stage of life.
So what's the big takeaway here? What does all this detective work really mean?
This is way more than just guessing. It's lightning-fast pattern recognition born from years of experience.
Every single pearl is a shortcut, connecting a subtle clue directly to a life-changing diagnosis.
It really is the art behind the science, connecting the dots that no one else sees.
It's that intuitive leap, seeing a tigroid appearance and knowing it means metachromatic leukodystrophy.
Ultimately, this expertise is what turns a complex scan into a clear path forward for a patient.
But this leaves us with a huge question. As AI gets better at this, will it replace the human detective?